This is the functional anatomy movement analysis for a bilateral dumbbell curl. The starting position is going to be standing for this. You're going to do forearm supination, which is a concentric contraction of the biceps brachii, supinator, and brachioradialis muscles. Then as you hinge at the hips forward towards your weights, you're going to have an eccentric contraction of the latissimus dorsi, triceps brachii, and teres major for this shoulder flexion. Then you have forefinger adduction, and this is a concentric contraction which will be held isometrically throughout the curl, and this is done by the palmar interossei muscles. Then as you reach down towards the two weights in front of you, you'll use a concentric contraction for scapular protraction, and this is done by serratus anterior and pectoralis minor. And then as you grip the weights, you'll use a concentric contraction that will be held isometrically, and it's going to be forefinger flexion done by flexor digitorum profundus, flexor digitorum superficialis, and flexor digiti minimi, like so. And then you'll do thumb opposition, which is a concentric contraction that will be held isometrically throughout the curl, and this is done by opponens pollicis. And then a little bit of thumb IP flexion can also occur, and this will be concentric when you first do it, and then isometric throughout the curl, and this is flexor pollicis longus. So as you grip the weights and stand back up, you're going to have shoulder extension occur back to the neutral position, and this is an eccentric contraction of the biceps brachii and anterior deltoid muscles, which are shoulder flexors. And then for stabilization of the shoulder girdle, you're going to have scapular retraction. This is going to be a concentric motion that will be held isometrically throughout the rest of the motion. This is done by middle trapezius and lower trapezius. And then lower trapezius will also engage a little bit with depression, which is the same. You'll have a concentric contraction originally that will be held isometrically throughout the curl. And then we will also do shoulder adduction for stability, and this is an isometric contraction. It will be done by latissimus dorsi and teres major. And then for the main part, we're going to have a concentric contraction for the elbow flexion that will be done by the biceps brachii and brachialis. And once you're at this contracted position, you're going to eccentrically contract the same muscles, biceps brachii and brachialis, for elbow extension. And it's also important to note that throughout this whole movement, there is a co-contraction of the wrist extensors and flexors to maintain a neutral wrist. And that would be extensor carpi radialis brevis and palmaris longus. So to put it all together, it looks like supination, eccentric shoulder flexion, forefinger adduction, scapular protraction to reach towards the weights, forefinger flexion, thumb opposition, some thumb IP flexion, eccentric shoulder extension back to the neutral position, scapular retraction, depression, and shoulder adduction for stability, concentric elbow flexion, eccentric elbow extension, and co-contraction of the wrist flexors and extensors to maintain a neutral wrist throughout the entire movement.